Hi guys, welcome back to my channel. Today I'm going to be talking about my clinical experience, first day of clinicals, and I'm going to be telling you things you need to bring to clinicals when on your first day of clinicals, and and a lot of other things that I experienced during my clinical day. But before I go any further into this video, I want to say thank you so much to my viewers and my subscribers. Thanks for coming to watch my videos and liking it, making comments. I'll try to respond to your comments as much as I can. So to not delay any further, let's go into this video. So my first day of clinicals was on Monday, September 9, 2019. Yay! And I had a wonderful experience. First of all, what I would say to you, be on time for your clinicals. That is very important. And why do I say that? Because for our clinical, when we got there, our clinical instructor wanted us to be able to meet with the night shift and day shift. And night shift leaves. So being there on time enable us to be able to meet those night shifts before associates before they left. And so that's why I said be there on time. And also it's also a good practice to be on time. And another thing I would suggest you do, like when it comes to things you need to bring to your clinical site, make sure you bring everything you have on your list. But for the most part, you do not want to forget to bring a notepad, something to write on. You need that. You need a pen and a notepad. Every other things that on your list, like stethoscope, um, pen lights, we didn't get to use it on our first day of clinicals because we didn't check for any heart signs or heart murmurs. We did not do those. But it's good to bring it. It makes you feel a part of the process because all the other nurses, they have their stethoscope on. So bring it if your school requires it. I know our school requires it, so don't forget to bring it. It's part of your attire. And also another thing, I'm gonna take my list so I don't miss anything. um you also want to come into clinical with an open mind, wanting to learn. I know it's kind of nerve-wracking, especially for us new students, but come with an open mind. Be free to whoever is going to be your clinical instructor. They are there to help us. Ours was really nice. When you see her on, like, when you meet with her the first time, you don't think that she would be that nice, but she was really nice. She was there to really help us, instruct us, and some express, fears about, oh, maybe we were like not too sure what to expect from a clinical instructor, but she calmed our nerves and she was really reassuring. She said certain things that she did not want us to do, and maybe like when we go to the patient's room and maybe a patient request us to bring them food, a snack or drink, we should make sure and speak with their tech or the nurse in charge before providing food for that patient, because that may be a patient who's going in for like surgery and is not allowed to eat. It's NPO, so you don't want to, even though you're eager to do this work, go and cause a damage to the clinical process where they have planned to carry out surgery, and because you've given the patient food, they cannot do that surgery at that time. So those kind of things. And also, like, not if a patient, you go into a patient room and the patient asks you to lift them up or take them to the restroom, go and speak with, tell the patient, I'm going to get your I'm going to ask your nurse. And then once you can, if the person really has to go to the restroom, get them a bedpan. That's what she suggested. So those are little, things to keep in mind. But other than that, the clinical instructors are there to help us, through this process. So go in there with an open mind. So what happened on our clinical day? Let me get to that now. When we got there, we were introduced, like I said, to the nursing staff, and our clinical instructor took us to see around the floor that we're working on. We saw different areas where they kept their supplies, so we saw those things. we can be able to go there. There are some that we don't have access to. We need either her code or we need the nurses to get into it. But as time goes by, hopefully we will be able to do that. Um, and so we saw that, and then after that, she assigned us with the tech that was working there. Each there was like two of us to a tech, and she had some students. I was assigned to a tech, and also there is a nurse that is assigned with that tech too. So we were able to learn from both of them, but mostly for the most part we work along with the techs, because basically what we are learning this semester, what I think, in my opinion, is about caring, nurturing. It's not about really treating right now. So we are pretty much learning to be techs right now. That's the foundation, how to care for patients. So that was what we were able to do. We observed the tech as she did her rounds, and then after a little while, our clinical instructor asked that we perform those tasks ourselves, and that the tech wash us. So we did that. We were able to do that ourselves. I was able to do vital signs. My colleagues were able to do that as well. And we did it for couple rooms, because we um did it one at a time, and you're two students per tech. So all the tech's assignments we were able to go along with her, and did we took turns, which was very helpful, because my first try, my first patient, I didn't feel so confident. Like, I was a little bit nervous. But after my first patient, the next one, I noticed that when I went in, I introduced myself well, and I was able to take the patient's vital sounds, and then ask them if they needed anything. When they said they needed nothing, I went out, you know. So go in there as nervous as you can be, but ready to learn, and that nerves is going to go away. Let me see if there's anything left that I did not speak about. And then when we were done with another thing she did was she documented. She showed us how to document, and she also allowed us to document. That is our clinical instructor. The CNA also, or the tech there, also documented, and she allowed us watch her. So we learned that from her, but our clinical instructor did that herself as well. And she allowed us, after she showed us, she's like, when you come from your patient's room, make sure you do your own documentation. So we're able to do that as well. And after our um, clinical site work, we went back into the conference room where we sat earlier before going on the floor, and we discussed how we felt about our first experience with her. And we were able to get to know each other, each member of our clinical site group, a little bit more. And that was it. That was the end of the day. It was a very beautiful day. We all left from there. I can't speak for everyone, but from the faces I saw, everyone was enthusiastic and happy for the experience that they had had. So I'm not going to let this video be too long. I'm going to stop right here, you guys. But go ahead and like, comment, subscribe. If you are in nursing school, you have had your clinical experience already, your first one, someone out there wants to hear about it, share with them, so you can help someone ease their nerves and help them to. Thank you so much, guys, and I hope you all have a great day. Bye bye.